Okay, so we talked about in short little chapter 7 sort of the terminology of thermal agents and the introduction to specific heat and heat transfer, that sort of thing. And then we're going to divide chapter 8 up into cryotherapy, which we're going to talk about right now, and thermotherapy, which is heat therapy, which we're going to talk about next week. So the first part of chapter 8 has to do with cryotherapy, and we're going to talk about the effects of cold, like what is the physiological effect? What are the clinical indications for cryotherapy? Contraindications and precautions, which you know that with all these modalities, I told you before, and I'm going to tell you right now, I want you to focus on indications, contraindications, and precautions. When do you do it? When don't you do it? And when might you do it? You want to think of it that way. What the adverse effects of cryotherapy could be, because there are some. Application techniques, and we will continue to work on those in lab. Documentation, and then do you use heat or cold? And you get that question from patients all the time. Well, should I use heat or cold on this? And we'll talk about reasons why you would do each. And we'll review that again when we talk about thermotherapy. So the learning objectives for this lecture, I want you to describe and be able to explain how the use of cryotherapy controls inflammation and edema. So with that rest ice elevation and compression and elevation, how are we affecting edema with that? Be able to describe that. What is the role of cryotherapy in spasm reduction? So we talked a little bit about muscle spasm, which is not spasticity, but also spasticity, and using ice to help control that. I want you to be able to state the appropriate application timeline of cryotherapy for acute inflammation. So now that we're starting to get into specific physical agents, this textbook is amazingly good at having specific application techniques. They have a box for each technique, and they talk about the equipment required, the procedure, advantages and disadvantages. They'll talk about contraindications and precautions, and so that's the information that I want you to be familiar with. So the timeline, how long are we going to use ice, when are we going to switch to heat or something else? I want you to be able to describe 3 ways that cryotherapy can control pain and why there is a lasting effect after the ice is removed. And I want you to be able to state the contraindications and precautions and why cryotherapy may be harmful. And the common sequence of sensations in response to cryotherapy. So one of the things that we're always doing with every intervention we do is we are educating our patients on what to expect. What does this do for you? What should you expect? How should it feel? And so I want you to know what know how to explain that to patients. And that's part of what we're going to test in the lab when we do lab practicals. I want you to test how you present this information to patients. So being able to explain something to somebody else is a higher level of learning than being able to answer questions about it or do a worksheet. So I want you to learn it so you can explain it to someone else. So here's our little cryotherapy agents. We have an ice pack with actual ice massage, and then the cold pack that we generally use in therapy. So there are 3 different types of effects that we're going to talk about of cold treatment. One of them is the hemodynamic effects, which is generally when you apply cold to the skin, it causes immediate constriction of the cutaneous vessels and reduces blood flow. So you get that initially, as soon as you apply it, you're decreasing blood flow. The vasoconstriction that you get persists as long as the cold application is limited to less than 15 or 20 minutes. After about the first application of 20 minutes, you can repeat later on, but you can have, we'll talk about the ongoing effects, hemodynamic effects, when you leave the cold on for longer than 20 minutes. So it has neuromuscular effects, which are basically a decrease in nerve conduction velocity, increased pain threshold, which is nice. Mainly, when we talk about, remember when we talked about pain threshold last quarter, pain threshold isn't how much pain you can tolerate, it's how much sensation you can tolerate before it initiates a pain response. So it increases that, so you can tolerate more sensation. It alters muscle strength, it decreases spasticity, and it facilitates muscle contraction. So the metabolic effects are it decreases the metabolic rate. So it's cooling those cells down, they are slowing down. So you can think of cold as almost you're slowing things down. You're slowing down nerve conduction velocity, you're slowing down blood flow, you're slowing down the metabolic rate. So this is the little chart from the book about how cryotherapy decreases blood flow. So you have decreased temperature, you decrease your vasodilator chemicals, the release of those. It stimulates cutaneous thermoreceptors, and it increases sympathetic activation that causes vasoconstriction, which decreases blood flow, and the decreased temperature also increases blood viscosity, which decreases blood flow. So, and the smooth muscle contraction contributes to the vasoconstriction as well. So lots of factors with cryotherapy, and you thought it was just an ice pack. But no, there's a lot of factors going on that help decrease blood flow. So when we have an initial inflammatory response and or an acute injury, we want to decrease blood flow so we can decrease edema in the area. So cold causes that vasoconstriction, and the immediate response is pretty consistent. But when you apply cold for longer periods of time, or when the tissue temperature reaches less than 10 degrees Celsius, which is 50 degrees Fahrenheit, you might get a vasodilation response. And it's called cold-induced vasodilation, or it's also known as the Hunting response. So the initial study was done in 1930, so a real long time ago, but additional studies have been done later and show that this is a common occurrence. Even though it's not a consistent response to prolonged cold application, vasodilation, it can increase vasodilation after about 30 minutes. So if you have someone who's got an acute injury and you put cold on them, initially it does vasoconstriction. That's what we want. We're reducing edema in the area. We're slowing down blood flow. If you left it on for more than 30 minutes, you could actually increase their blood flow, increase vasodilation, and cause more swelling. Cooling also decreases the oxygen hemoglobin dissociation, making less oxygen available to the tissues. So you don't want to do it for too long. So what I generally tell my patients is when you cool your tissues down with ice, you then have to give the tissues time to get back up to normal temperature. So I usually recommend when people are doing it at home, of course in the clinic we have control, at home we don't, but I recommend to people that out of an hour, they spend, if they spend 20 minutes icing, they spend the other 40 minutes letting the tissues come back up to temperature, just to avoid this cold-induced vasodilation. So these are the temperature effects on oxygen hemoglobin dissociation. So it's just harder to oxygenate the tissues at lower temperatures. So what we're going to use cryotherapy for, so these are your indications, clinical indications for cryotherapy. We're going to use it for inflammation control, edema control, pain control, that's a big one, modification of spasticity using prolonged icing, Symptom management in MS. So a lot of times people with MS are affected by heat. So you can actually use cooling vests and other cooling garments to help modify their symptoms and manage them. You can use it for muscle facilitation, and you can use it for cryokinetics and cryostretch, where you're trying to affect the movement in the muscle. So for inflammation and edema control, it's our classic RICE, rest, ice, compression, and elevation. So this person obviously dropped an oxygen tank on their foot. I'm just kidding, I don't know what they dropped on their foot, but we see that bruising. So we've got inflammation and we're trying to control edema. They're resting it, they're elevating it. We've got ice and compression on there. So for contraindications and precautions, and these are all listed really nicely in the book, I've got to tell you. The thing that I like about the way they do it in the book is they list all of the contraindications and why they're contraindications, and then they have questions to ask the patient. So that is a really good thing. Make note of those ask the patient questions. That's a really good thing to use in your lab practical to show the examiner that you know what you're talking about in terms of contraindications and precautions. So contraindications for cryotherapy include cold hypersensitivity, cold intolerance, cryoglobulinemia, paroxysmal cold hemoglobinuria, Raynaud's disease, areas of regenerating peripheral nerves, because we don't want to slow down nerve conduction, areas of circulatory compromise, and the precautions, meaning contraindication you can think of as an absolute contraindication. Don't do it. Precaution, you can think of it as a relative contraindication. Maybe you do it, maybe you don't. There might be a reason why you might do it, and you're going to be cautious about it. So precautions include putting cold therapy on the superficial main branch of a nerve. You're going to deaden that area. On an open wound, when you have someone with uncontrolled hypertension. Anytime you have someone with uncontrolled hypertension, anything that changes their fluid dynamics could affect their blood pressure. If someone has poor sensation, they're not going to be able to tell if it's too cold, or poor mentation, same thing, and that's always a precaution for any physical agent. Someone who's very young or very old, they might have either poor sensation is really common in the very old, or the very young, they just might not be able to tell you that it doesn't feel right. So there's some pretty serious adverse effects for cryotherapy. Tissue damage or tissue death. So tissue damage can occur when the temperature reaches 15 Celsius, which is pretty darn cold. Freezing or frostbite at 4 to 15 degrees of Celsius. So you always want to keep the tissue temperature above 15 degrees of Celsius to avoid tissue death or damage. And we're going to do this by keeping the application time to 45 minutes or less. And because of the potential for the cold-induced vasodilation, I would say keep your application to 20 minutes or less. So the application techniques that we are going to use in the clinic potentially and in the lab certainly, cold pack or ice pack. Ice massage is a wonderful way to cool an area down fast and control pain. Controlled cold compression units, sometimes they're called Game Ready. Game Ready is a brand, but CryoCuff is the other name you'll hear. And Vapocoolant Spray, which uses evaporation to do a quick freeze, basically, on somebody. So here are our cold packs. I've really never been in a clinic where they kept the cold packs in a hydroculator, but most of the time it's in the freezer. They come in different sizes, so you can apply them to different areas of the body. A long time ago, Medicare and other insurance companies usually follow Medicare's lead on things. They decided they were not going to pay for cold packs and hot packs because the patient can do that at home. And that's legit, I think. So when we're doing cold pack and hot pack treatments, in the clinic, we're not charging for them. So you're going to figure out when you're going to do them. A lot of times if I'm doing a cold pack at the end of the treatment, say I have a 45-minute treatment, I'm going to treat for 40 and ice for 5. Or if the patient can stay with a timer, I might ice for 10. But I'm not doing extended icing sessions in the clinic. If I'm doing something that's more hands-on, like ice massage, with ice massage, we'll do this in the lab and you'll see, you only do it for as long as it takes to numb the area, and it doesn't take long. When you're applying ice directly to someone's skin, you don't have a towel or anything slowing down thermal conductivity, and it cools down really fast. So you can usually do ice massage in about 5 minutes, maybe 7 minutes for a larger area, and you're generally not charging for that either. That is just part of your treatment that you're not charging for. We'll talk in the documentation and charge codes lecture. We talked about the times that you're charging for a unit. So you have to do something for at least 8 minutes in order to be able to charge for it. Well, ice massage just doesn't take that long. So if you're doing something for 5 minutes, you're never charging someone for it. That's just part of the treatment. Another thing that I rarely charge anybody for is taping, and we'll talk about that next year in your manual therapy class. Because I'm not going to spend more than 5 minutes taping someone in the clinic. I don't think it's a good use of their time or money or my time. I think taping is an excellent intervention for a lot of things, but it doesn't take that long to do. Ice massage, so this one's got the ice popsicle there, or the ice cup. There are also plastic 2-part ice cups that a lot of clinics have that you can use to freeze a block of ice for ice massage. If you're going to recommend that people do it at home, I tell them to use just like a Dixie cup and freeze their ice in that. It works really well. This is the Game Ready or Cryo Cuff. You basically put water in the unit, and then the cuff part wraps around the patient, and it's really effective for cooling stuff down fast. I've never worked in a clinic where we had one of these, but I have one time when I worked in a skilled nursing facility, there was someone that came in after their knee replacement that brought their own from home, and so I used it on them for about 6 weeks, and so I got some experience using that, which was nice, and it's very effective. It does work. It's easy to use, and it works very effectively. The Vapocoolant Spray, usually you're doing a quick stretch and spray, like the person in the picture is demonstrating here, and we'll talk about that in lab as well. Documentation includes area treated, cooling agent, how long you did it, what position they were in, and their response to the intervention. So if they didn't have an unusual response, you don't necessarily document it. So you might say cold pack times 5 minutes to right knee with legs elevated, period. So very straightforward. So then you just know what you did last. The next time when you look at it, you know what you did. You're not charging for it. So there are CPT codes for cold and ice pack, but you're not going to use them because you're not doing it. You're not going to get reimbursed for it, for one thing, and you're not doing it for long enough to charge them. So there are CPT codes, but we're generally not using them. So this is the table 8.1 from the book, Choosing Between Cryotherapy and Thermotherapy, and it talks about the effects and whether cryotherapy or thermotherapy increases or decreases them. So with pain and muscle spasm, either one can decrease pain or decrease muscle spasm. So that's kind of nice. And with spasticity, cryotherapy can decrease spasticity, but thermotherapy has no effect. So you're never going to use thermotherapy for spasticity. So most things on this list, cryotherapy decreases and thermotherapy increases, except joint stiffness. So blood flow, edema, nerve conduction velocity, metabolic rate, and collagen extensibility are all decreased by cryotherapy. And all of those are increased by thermotherapy. Joint stiffness is increased by cryotherapy and decreased by thermotherapy. So in a nutshell, there's your nice little, so that would be a nice thing to know. Those are good questions to ask. Which one of these is going to decrease blood flow? Well, cryotherapy, if you're going to ask that question. So this is a nice little chart that kind of sums it all up.